How are you going to lose that face fat? If there's a fat face or the fat seems to be shifting, we're talking about this today, from things you can eat, facial exercises, devices, even injections. We're covering it all. Why don't you just suck the fat out of the face? We're talking about it. Let's dive in. So life isn't fair sometimes. There's people who want more fat in their face. They want to make their fat pads more healthy. We can do that. But there's a lot of people that have fat in their face that they don't want. They think their face is chubby or round, or very commonly, because we all age similarly actually, is that the fat is descending. I'm getting sag. I'm getting the RBF. Is that true? And what can you do about it, whether any one of those pertains to you? Number one to address is weight loss. For sure, when someone loses weight, they lose some weight on their face. Now, if you're at your ideal weight, this might not apply to you, but if you're not, that is the first least expensive thing to do, but it can be the most difficult. How do you want to approach it? You need to exercise. I always say if exercise were a drug, we'd be billionaires because it would be the best drug on earth. That's how well it works. It's studied, but there's no incentive for people to study it that well. Get rid of a lot of high carbs, a lot of sugars. Processed foods kill you. They go right here. So the first thing to do is lose weight. And someone asked me the other day, hey, if I lose weight, won't I get loose skin? And it's a great question. If someone's a little older, loss of collagen, loss of elastin, yes, that can happen. For the most part, if you're taking care of your skin or you're a little younger, the skin will tighten around it. But it's better to do that for your overall health and then address it in the other ways I'm going to talk about today. Number two, and I am talking about it, you guys love it, it's facial exercises. Understand this is outside of my wheelhouse. I have a lot of patients who do it, who try it, who can't continue. And that's why they're coming to see me. Understand, so I'm getting a skewed segment of the population. However, I hear from you guys, some like it, some think it's a waste of time. In the comments below, you're going to comment, let me know, do you like facial exercises? If you ask me, I have yet to see a patient come in who says, I've done facial exercises, here's my picture that you took, so I took, it's standardized, it's 3D, and I haven't seen you in a couple of years. I did these exercises, look at my face now, and it is thinner. So I have no data on it. Yes, there's not a lot of incentive for people to study it, but I want to hear below, a lot of people do say they like facial exercises. I think there's no harm if it works for you, saves you money on fillers, injections, and all the crazy stuff I'm going to dive into now. So why don't we simply go in and suck the fat out? Just like you might do liposuction under the chin. We'll start with the elephant in the room and one of the most invasive ways to do it. You can suck a little fat out through with a micro cannula, like a smaller type of cannula. You go in, you tumesce, you put some fluid, you suck it out. Here's the problem. There's facial ligaments. And if you do try liposuction, and I'm talking about the whole face, even the RBF at the edge of the mouth, if you try and do that, there's a very high rate of a few things. Number one, irregularity of skin. Number two, you are left with loose skin. Number three, there's a facial nerve, a branch of the facial nerve that comes down. And if you get that, if you transect it, and if you do aggressive liposuction, the risk goes up. It's a career-ending type of move. Now, it's very rare because everyone knows, and often you're in a different plane when you're sucking the fat out, then the nerve is a little deeper. However, you can't just go suck the fat out of the face because there are important nerves of expression. And think about this, you go in for a procedure and you come out and you're not moving the same. Okay, Justin Bieber, okay, a whole different problem of facial movement, okay? But devastating injury or Bell's palsy, think of that when you're thinking it. So liposuction isn't the answer. If you do, it's micro liposuction with a facelift, so you can release the ligaments and lift up. Otherwise, it's just not good to go suck the fat out of the face. It's not a thing. Buccal fat removal, yes, that can be done. It can be an aging procedure. If it's in the right client, right patient, it looks good, but also can be an aging. And think about that. That fat is submalar. It's up here. It's not down here where a lot of people want it done. So if you can't do that, what are some things that I do? Number one, tightening devices. So you guys comment all the time, HIFU, high intensity focused ultrasound, ulthera, that you lost facial fat. I have a whole video. I'll put a tab up here and a link below on that video. This device ruined my face. Okay, there's two things that can happen. You can get your fat for sure, okay? So we can target fat. That's a good thing if you want it gone. It's a bad thing where you want to maintain in the upper face. The other thing is, understand, a lot of these people that will say that, if you look and you volumetrically assess them with 3D imaging, what you find is they had skin tightening. So the sagging skin, look, it came from the frame of the face, it sagged down, it gave the effect of volume. Now you've tightened the skin with the device, which is what it's supposed to do, and you've also tightened the fat pads, so it looks like you've lost a little bit of volume. So understand, but you can use them to target fat. Number two, in things that I do that you can do that's non-surgical, minimally invasive, RF microneedling. Now this is something I do on a regular basis to target fat. Almost all of us age by getting submental sag and fat, changes in the fat pads here. One concept you need to understand, it isn't just that the fat pads sagged, it's that they grew. The nasolabial fat pad, it grows. The fat pad down by the preauricular zone, down by the edge of the mouth, okay, the oral commissure, that grows, and then bone loss in the chin, in the bone here, back here, that all makes it collapse. So it's very complex. It's not as simple as just sag, but with RF microneedling, there's two great things. Go in, target the fat, medium to high heat, deep needle penetration, 3.5, 4 millimeters, and long duration of heat. So it's all about the heat, the duration, and the depth, but you target fat with it. Every device that's great, because you're gonna ask me what device, can harm someone. You might call removing fat from the face harming them. In the right area, you're helping them. So RF microneedling is another. The third, Kybella injections. Okay, I do it. I've actually done it on myself, so you can do it here. Am I over the top impressed by it? No. Do I like it? Yes. Would I do a full face? No. Couple issues. Number one with it is it targets the myelin in the nerve where the nerve jumps, boom, boom, boom. And you can lose function of a nerve. It usually comes back after 2 to 6 weeks. I've had patients who've had it done that I have harmed their nerve from it. Always comes back. How do I do that? I tell them, hey, do it at a good time for you. If you get a droop in the face, is it okay? Oh yeah, I'm going to climb mountains, I'm going to activity, I'm going to sports. I don't care, it'll come back. But if you have a wedding or an event, I don't do it. The results, okay, takes about 2, 3, 4, 5 sessions. This is resistant fat. It's not the exact thing you want to do for the face. And remember, Kybella is deoxycholate. If you talk to the mesotherapists of the world who invented all this stuff, deoxycholate, phosphatidylcholine, that's the combination really you want to look for. Kybella does work well. If I had my choice, I would have a combination, PCDC we call it, but there's not a lot of fat. So there's ligaments, there's muscle, there's bone, but there's a couple millimeters of fat down here. There's not a lot to target. So even if you got rid of all of it, it's not going to be this huge impressive result because you need a lifting effect as well. Finally, volumizing. So if there's gain in the upper face as per your consult, a hollow temple, a zygomatic bone that is deteriorated, we'll use that word, that is osteoporotic. If you have a preauricular hollow where there's gain, where I can volumize the upper face, microneedle the lower face, win-win-win. That candidate, I'm gonna have 100% success every time. And I don't delegate this stuff. If I'm doing my RF microneedling, I'm doing it because I know I need the exact right settings and I know every face is different. But if I have that kind of gain in a face, if I have a round, fat face, someone who doesn't have fat in the body, but there's a lot of facial fat, I can't add filler or I'm gonna bloat them. So I only now have Kybella, RF microneedling, and ultrasound as an example of heat sources to deteriorate that fat. But facial volumizing by way of a lifting, by way of contouring, can certainly lift the lower face. It's not going to be the least expensive thing you do. Volume costs money. So by far and away, healthy lifestyle, losing weight, and then looking towards the facial consult for procedures that might work for you. I want to know, Do you have anything to add? Have you had it done? I put a video here on this device ruined my face, so you learn a little bit more about the fat pads in the face and why a great device can harm your face.